Right, so the knee joint is one of the joints of the lower limb, which is between the thigh and the leg. It is a very large joint, very complex joint, and it transmits the weight from the upper body to the leg. It's the most complex joint in the body, and it is also the most superficial joint that you can have. It is complex because it is the junction between the two large bones, in the lower limb. It begins development, as I said, from 6 weeks, and it continues to develop. And in a male, the joint is fully developed when the bones fuse at about the age of 20 years. In females, it's stopped developing around the 16 to 19 years. Right. So the knee joint is between the lower end of the femur. As you can see here, there are two bones on the lower end of the femur, what we call the femoral condyles, and then also the condyles of the leg bone, which is the tibia. As you can see, the top of the leg bone, which is the tibia, is pretty flat. So it's the thigh bone sits on it as if it's sitting on a table, and therefore it makes the joint a little bit unstable. And to be able to make it a little stable, there are cartilages which are placed on top of the leg bone, that's the tibia, so that the two bones can fit each other very, very well. And as I said, there's a third bone which also forms part of the knee joint, which is this bone here called the patella, or the kneecap. And so altogether, there are three bones that are involved in the formation of the knee joint. Now, when the joint is formed, there are certain mechanisms that enable it to be stable, because, as I said, the large surfaces of the femur is sitting on the flat upper surface of the tibia. There's the need to ensure that the joint is stable. And to be able to do that, a number of factors are involved. And these factors are the ligament that we know about the joint. There are a number of ligaments around the knee joint so as to enable it to be stable. The first one I want to talk about is the patellar ligament, which lies directly in front of the knee joint. This is actually an extension of the muscles in the front of the thigh. They are the end of the muscles in the front of the thigh. The muscles we call the quadriceps muscles. And so these tendons are extensions, or are the end of the quadriceps muscles. So that is why it is important for athletes to train the muscles in the front of the thigh so that it can be firm enough to support the knee joint. The other ligament around the knee joint is on the inside of the knee. The medial aspect of the knee is on the inside of the knee, and that is the medial collateral ligament. Medial collateral ligament. This ligament supports the knee joint on the medial side or on the inside of the knee. And whenever there's angulation between the bone of the leg and the thigh on the side, it puts tension on that ligament, and so it is at risk of being damaged. The medial collateral ligament, it's fairly thin. It's fairly thin, and it is one of the ligaments that is likely damaged in athletes. The third ligament is on the side, the outer part of the knee joint, that is on the lateral side. And this ligament is known as the lateral collateral ligament. As you can see, it extends from the femur to the fibula. Unlike the medial collateral ligament, this one is cord-like, and it is very, very tough ligament. It protects the lateral side, or that is the side, the outer side of the knee joint, and prevents the knee from dislocating. It is so strong that sometimes, in order for it to tear, the small bone of the leg, that's the fibula, will rather break or rather fracture. There are also ligaments on the posterior aspect of the knee, that is on the back of the knee. There are two ligaments there. We have the oblique popliteal ligament, which is not present in this image. It crosses obliquely at the back of the knee joint and protect it. Then also on the lateral side, we have arcuate popliteal ligament. Arcuate popliteal ligament. These are thickened portions of the joint capsule of the knee joint. Now, all these ligaments that I've mentioned so far are outside the joint space, are outside the knee joint space. But we also have some ligaments that are inside the knee, the joints, the knee joint. And so for you to be able to see them, you have to more or less open the knee before you can see them. And there are two important ones that I want us to identify. And these ligaments, there are two of them. There's one from the front to the back, and then the second one from the back to the front. So we call them the cruciate ligament. We call them the cruciate ligament. The one that comes from the front to the back is known as the anterior cruciate ligament, or what we know as ACL. And then the one that comes from the back to the front is the posterior cruciate ligament. Now the question is, why do we call them cruciate ligament? The two ligaments sort of cross each other in the form of an X, or the cross. We know that the crucifix, the cross on which Christ was crucified, we all know that it's called a cross. So these ligaments, because the two of them cross like that, we call them cruciate ligament, just to indicate that they form a sort of cross within the knee joint. They are very, very important in the support of the knee joint, especially movement between the bone of the thigh and the bone of the leg. They ensure that they don't move without each other, So the anterior one is the weaker of the two, right? Anterior cruciate ligament, or ACL, is the weaker of the two, and it is the one that is commonly ruptured in athletes. And because it is made up of connective tissue, tissue that doesn't have a lot of blood supply in it, when it ruptures, it takes a very long time before it heals. And you cannot put them together for it to heal, but rather you have to operate on it. And sometimes you may have to replace them with a material harvested from other parts of the body. So that is the anterior cruciate ligament, which prevents the movement of the bone of the leg forward, whilst the bone of the thigh is stationary. So if the bone of the thigh is held in one place and then you push the bone of the leg forward, the anterior cruciate ligament is not going to allow you to do that. So whenever it ruptures, then you can easily pull the tibia, that is the bone of the leg, forward, whilst the bone of the thigh is stationary. The posterior cruciate ligament, that one comes from the back to the front, and it is much stronger than the anterior cruciate ligament, and it is less likely to be damaged during sporting activities.
Now, so this is a very strong ligament in the knee joint, and as I've said, it plays a significant function, which all active and professional sports people rely on. They rely on its integrity to carry out their sporting activities. Unfortunately, some of them rupture this ligament, and some of the common things that can make it rupture, especially if you accelerating and you suddenly start to decelerate, reduce your speed, you could injure it. If you engage in sports where you change directions a lot, so you are pivoting and all that, you could injure it. If you have sometimes some kind of contact, very strong contact that put a lot of stress on the ACL, you could rupture that as well. But there are certain sports where it is more common, like in football, soccer, skiing, basketball.
Okay, so in my career as a football coach, knee injuries occasionally occurs, and ACLs are most serious. Yes, ACLs can happen during poor warm-ups, poor training plans, and usually when coaches without enough knowledge about ACLs give bad training schedules for players, and then they face such problems.
I say like, Ubobo sana ubra, energy sanya maniba. Sometimes we go treatment, we come massage, we sanya man. Sometimes doctor can say relax, but they relax. Oh, the feel say okay, you know.
Usually when people suffer ACL injuries, immediately they stop. Okay, they feel some pain. Some may try to go back, depending on how much pain they have. But then you realize that they struggle on the field and most likely pull out. They're not able to continue playing.
When you stand on the touchline whilst they are playing or warming up, you can hear a pop sound. Or when you look closely to the knee or let's say the ankle, you can see a swell. As well. So these are ways that we use to often detect or get to know. But usually we have to test. We have to test them to see if truly it is an ACL or something. Yeah.
It's easier to examine the person because the swelling is not that much. But let's say after 2 hours, usually they'll report to you a day after or within 2 days. And at that point, the swelling is so intense and the pain is so intense that you can't examine very well. But taking a good history, okay, talking to the injured athletes in depth, allowing them to describe what happened, what they were doing, whether they felt a pop. Some of them will tell you they felt a pop or something give way in their knee, and that is a diagnostic sign to help you know that this person may have ruptured a cruciate ligament.
It's here a work second.
Okay.
I say that they are work soon. They say a work now. They want me to say ACL because we write media. And no, I want me pop. I said they are work. ACL they kind of.
Okay.
So some of the risk factors for ACL injuries, obviously, if the pitch or the surface on which the player is playing or competing is not fit for purpose.
The problem we are facing here is the pitches. The pitches are not good. That is why sometimes the players will got injury and things. Now they've got a whole lot of steps like astroturfs and things, and that one is more harder than our normal grounds.
You know, warm up is actually a very important aspect of almost every sport. Fortunately for me, I've done more than one sport, so I've seen the kinds of warm up that they do, and most of them know which parts of their body are prone to injury as far as that sport is concerned. However, sometimes there are some athletes who don't want to do a proper warm up, but they want to participate, and when they are not lucky, and well, those are in the minority, they do get injuries. So in my view, I think that a good warm-up is always very important. Literature has also shown that it's useful for the body to be able to perform well. So I think that proper warm-up is always useful. It is important. It also helps to prevent injuries. And I think that is the reason why the FIFA 11 Plus is a very useful tool for almost every sport as far as warm-up is concerned. Unfortunately, I know that FIFA has invested a lot of money in Ghana. Coaches have actually been taught, but when you move around, you hardly see them use the FIFA 11 Plus warm-up. It's very, very, very useful because I've forgotten the exact figure, but they've indicated that the percentage, reduction in injury is very high. If I recall, I think it's around 25%. The risk of injury is reduced by about 25%. So I don't know why we don't use it in this country. I find it quite unfortunate. But warm-up is always very useful. It's very, very useful. And this is based on a study done by FMAC. I'm sure you know what the FIFA Medical Research Committee. So it's very authentic. And every sport and any sport can use that warm-up regime. I think it's about 25 minutes or so. And I'm sure that's what discourages a lot of people from wanting to use that warm-up regimen. But of course, whatever warm-up regimen you have, it has to be done well. It helps to prevent injury.
Who warm up well? Let's say some players just come and start kicking. Usually during my sessions, I even call my boys and tell them that, look, I don't want to see you kicking if you have not properly warmed up. So with a proper warm up, ACLs are prevented. But with a poor warm up, it is likely a player can get ACL.
Having had a previous knee injury may also put you at risk. And in certain cases, certain overuse injuries or where players are not resting well and are playing day in, day out, they are also at risk of developing some of these injuries.
Like, sometimes we go treatment, we go massage, sometimes doctor can say relax, but yeah, relax. Oh, the fish say okay. You know, sometimes it's easy. Easy. Recovery easy.
So during ACL reconstruction, the surgeons usually look for a suitable body part that can replace the ligament, and usually they would go in for part of your patellar tendon. The patellar tendon is right in front of the knee. It's a very strong tendon, and they would harvest part of it, and that is used as your new anterior cruciate ligament is drilled into the femur superiorly, and then the tibia inferiorly. And once they angulate it well and put it in place, they are done with your surgery, and then a lot depends on your rehabilitation. Rehabilitation could go on for anything between 6 to 12 months, depending on other injuries that the athlete may have suffered, and also how the athlete responds. I must say that there could be a few complications and setbacks after surgery, but by and large, with good rehabilitation, the swelling goes down, the stiffness goes down, mobility is addressed, so your knee tends to bend and extend very well.
Well, essentially, rehabilitation is like a bridge between injury and return to play. So when an athlete gets injured, the athlete has to go back to play. So it is that thing in between the injury and going back to play that I would like to describe as rehabilitation. So I don't make it too technical in terms of definition. So it's just a bridge between injury and return to participation or return to play. Rehabilitation does not occur only after surgery, but that also would depend a lot on the surgeon. But we all know that it has to do with muscles a lot. Of course, proprioception comes in. So because after the surgery, you want to do some strengthening apart from healing and stuff like that, it is prudent, if it's possible, to do something before the surgical intervention, and that's called prehabilitation. So you may want to do some strengthening, to the muscles itself, get some strengthening before you go into surgery. So immediately after surgery, you can actually go back and continue with your rehabilitation. But when you come out of theater immediately, what happens is that the best shot is to do some continuous passive mobilization at the knee joint, at least just to have some movement. But that does not amount to strengthening. So if you have some strength or good muscle bulk before you go into surgery, it's quite helpful. So that a couple of days after the surgery, you can now start that muscle strengthening again, aside the fact that you want some healing, proprioception and stuff like that. healing is part of, our treatment modalities, because usually when clients come in, it's possible that they have pain, apart from probable loss of strength, loss of range of motion. And these are things we will deal with. But if there is pain is one of the things you'd want to alleviate before you even move into strengthening the muscles, improving range of motion. So when it comes to the healing process, yes, physiotherapy will definitely, play a role. And you know that anterior cruciate ligament, it's a tough structure, whose healing is actually very, very slow. So we wouldn't just jump into wanting to improve range of motion. And the surgeon will always tell you, you have to be careful with it, because that's actually a very difficult structure to also deal with, so that you don't mar what the surgeon has done. So we play a very significant role as far as the healing is concerned, with some of the modalities that we use, okay, to help to bring the pain down and improve the healing process. Then we can go into strengthening mostly the soft tissues around the knee joint, and then increasing muscle bulk for future use.
Rehabilitation could go on for anything between 6 to 12 months, depending on other injuries that the athlete may have suffered, and also how the athlete responds. I must say that there could be a few complications and setbacks after surgery, but by and large, with good rehabilitation, the swelling goes down, the stiffness goes down, mobility is addressed, so your knee tends to bend and extend very well. You may have some muscle atrophy on the affected side, which makes it weaker, but the physios are able to work on all that as well: your muscle strength, muscle flexibility, joint flexibility. They even look at other parts of your body, so they don't just focus on the knee. They may focus on your hamstring muscles, your quadriceps muscles, your ankles, your spine, lower back, to make sure that your condition, you are tuned in very well, and you don't have other problems that may lead to subsequent knee injuries again. Having said that, the psychology, or the athletes, when they get injured, athletes also go through some psychological stress. There's a lot of anxiety as to what's going to happen next to them, because this is an injury that is career threatening, and some people actually have lost their careers because of such injuries. So athletes are aware, and they become very anxious about and worried when they suffer injuries like this. So they definitely need some psychotherapy. They definitely need to be helped to get their confidence back.
Yeah, the psychological aspects of healing for me is crucial. And that is why, as an individual, I always have a challenge when it comes to, sports in Ghana. That, we are trying, we have the physician, we have the physiotherapist, we don't have the psychologist. It's not everybody who is mentally strong. But aside that, when injury occurs, you need a lot of, mental psyching, to get the person back to go and do what he normally does again. No matter how good the person is, there will be some holdback. There will be some fear that, this could happen again, irrespective of how well it has been done and everything is put in place. So I think that as a physiotherapist, it's very integral for us to have, the psychological aspects also very well dealt with when we are actually taking a player who has an athlete who has an ACL injury through rehabilitation I mean, there must be a lot of psychological input as well, in my view.
So the athletes need to regain their confidence so that they can perform, not feel scared of suffering a re-injury or losing their careers. So psychotherapy is a very important aspect that we should consider when athletes have this injury. They, their nutrition must be adequate because once you suffer an injury like this, your body needs to heal well, ligaments needs to heal well, muscles need to heal well, your meniscus, the general health of that knee joint needs to be optimal. So those are the important factors to it. And during their rehab, it is graduated. So they move from low levels, from stretching, trying to get their joints mobile again. Then their physical therapist just keeps shifting into various levels, and they progress. And at every point, they need to be assessed to know whether there are certain complications that have developed that need to be addressed before they move ahead. Otherwise, you move ahead and you suffer another injury, and it's a setback, and it can be very, very it can be very, very disheartening for the professional athlete. So they need to be assessed as you go along. They need to be informed about anything that is observed and what the implications are. And they need to be brought on gradually into top flight sports.
When players usually come back from such injuries, we introduce them into the game slowly, not that they should go in fully. So little by little, we introduce them, let's say 78 minutes to end of time, let's say 60th minutes to end of time, just for them to, and we don't give them top row or a tough row. We give them light to for them to, get into the game. Yes, till they recover fully and build up their confidence before we can introduce them fully into the game. Yes.
Science is improving, and I'm sure that soon ACL tests will be managed in such a way that within 6 months, athletes can return to their sporting activities. So basically, this is about ACL injuries. Like I said, it's a very crucial ligament. That's why it's called cruciate. There's a posterior cruciate ligament as well, but the ACL seems to be the one that gets more often damaged.